Welcome to Rooted in Wellness. I'm your host, Dr. Peete, and this is the space where we amplify medical professionals and thought leaders committed to healing our community from the inside out. Today's episode is titled Rooted in Life, Understanding Cardiovascular Health, because when we talk about wellness, we must talk about the heart. Joining me is Dr. Deiadra Rice, a board-certified cardiologist dedicated to improving cardiovascular outcomes, particularly within the Black community. Dr. Deiadra, welcome to the show.
Thank you.
How you doing?
I'm great.
Okay. All right. So we're going to go ahead and get started with our first question. Okay. Why cardiology and why does it matter?
Well, actually, I started out in trauma, and I loved it. I knew that's where I was going to be.
Okay.
But once I look back on that aspect of my career, the one thing that we feared in trauma was cardiology. Yes. So you fast forward, and I'm like, you know what? I want to challenge myself. Hence, back to school, changed my focus, went into emergency, acute care, and then into cardiology eventually. And with cardiology, I would say, everybody will argue. You get a neurologist in here, they'll say the brain is the most important part.
True.
You get a nephrologist in here, they'll say the kidney. But for me, I believe it's your heart. Your heart is the most important part of your body. You cannot function without a heart, plain and simple. And with that, cardiovascular health is very important. Cardiovascular disease is the number one killer of men and women, and it has been for quite some time now. So I think it's imperative for people to understand what cardiovascular health involves, how to keep themselves healthy, and ultimately how to live longer. With cardiovascular health being I wouldn't say a new profession, but it has progressed greatly over the last 40 to 50 years. It is paramount that we keep up with the times. Right. We're living longer now, and I want our people to not only survive, but to live and live well.
Okay. So when you kind of look at the Black community here in Memphis, just specifically, what concerns you the most about the cardiovascular health?
Our diet. Our diet is a big part of it. And then, too, I would say our diet, second to knowing our family history, knowing what things ail us, and following up with health care. So, look, you said one thing. It's multiple.
No, it really is.
It really is multiple.
It is.
Let me start with the first thing. The first thing I would say is seeking health care.
Right.
And a large part of us seeking health care is not that we don't want to, it's our access. With that access comes knowledge. With that knowledge, then you're able to better do for yourself. If you go to the doctor and the doctor tells you, hey, this is some things that are concerning me about your health, you have that access. Then the doctor says, hey, these are the things that you can do to change your health. Then you have that knowledge. I believe our people want to do better. Our people want to live well. It's just, do they know how? Do they have the access to do it?
Yeah. I can see
is it affordable? You know what I mean? Those things are kind of what plague us mostly.
Okay. So statistically, blacks face more, we have a higher rate of hypertension, we have a higher rate of stroke, we have a higher rate of heart disease. In your professional opinion, what's the biggest driver?
Really I would say it goes back to the knowledge of our bodies. I can have two people in front of me. I can have a black man in front of me and a white man in front of me. That black man is going to have more of the hypertension. They're going to have more of the kidney disease. They're going to have more of those things. There are a lot of driving forces in that. The makeup of our system is different. We are a great race of people. Because of that, we are not studied as well as I think we should be. We have a higher rate of hypertension, and people say, oh, it's the food that we eat, it's the things that we do, but a lot of times you can do all the things right and our people still have hypertension. I believe it's the overall makeup of our body. It's the mechanisms that drive us are totally different from other races. It really is. It may take one drug to treat hypertension in a white person, but it's going to take 2 or 3 for us. And even if you go, let's go as fundamental as like the BMI. We talk about that all the time, BMI. If you all look at me, I don't consider myself overweight. According to that scale, 5 more pounds, I'm overweight.
Yeah, they say
Our body density,
I'm
the
obese.
way, right, you're obese.
They
You
say
see
I'm
what I mean?
obese.
The way that it is made up, it's not the same. You can't treat us the same. And going back to your question, granted, it is our diet. We do eat a lot of salty things, the way that we prepare our foods, but that all comes from our ancestry. That is deep rooted in us. That is not something that we just started doing. Back during the days when we didn't have much, we used what we had.
True.
We figured out a way to make a little stretch a lot.
Yep.
Unfortunately, the processes by which we do that aren't the healthiest. That's what we had. That's what we know. So you go into a store nowadays, and a lot of my patients say, hey, how do I reduce salt in my diet? That's the biggest thing. Mostly everything in the market is preserved with salt. And those things that aren't are expensive. And I get that. But hey, let's try to lower it in different ways. So I think a big part of it is who we are, our makeup, and then our diet.
Okay. So do you consider it being more of a us just in general dealing with chronic stress, or just long-standing systemic inequality? I mean, where I'm going with this.
Yes.
Where I'm going with
this. It is. I will tell you this. If you can come out into our neighborhoods, and there's a dialysis center on every corner. Every single corner.
I thought I was the only one that was going crazy, because in the
there
Haven,
are more dialysis centers than there are Walgreens.
For real?
Think about it. In every corner. If there aren't more, they're tit for tat. They're neck and neck. But you go out to other neighborhoods and you might see one. And if you do, it is so inconspicuous that you don't even know that's what that is.
Be real. I think I saw one in Cardiovascular.
One.
I think I seen one in Cardiovascular.
One. We got them on every corner.
And if I go down to Whitehaven or Orange
Yes,
Mound, it's
you
like,
go down Elvis Presley, you will see 5 before you get a mile and a half down the road.
You see it on Shelby Drive.
Yes, absolutely. Okay. But with, one thing that I wanted to talk about as well is just our family history on things, especially with cardiovascular health. You can do all the things right. You can eat well, you can have a great diet, you can exercise, you can weigh what they say you should weigh, and you will still find yourself plagued with cardiovascular disease. And a lot of that is because you can't escape bad genes. I tell people the first patient I ever took care of, ate rabbit food, was a marathon runner, thin, tall, lean person, but had quadruple bypass surgery. But his brother, uncles, dad, all the men in his family had cardiovascular disease and had stents and had open heart surgeries. The only difference was they were in their 50s and he was 74 when he had his surgery. So while he beat the clock, he still ended up in that same position. Okay. So a large part of cardiovascular health is what we do to ourselves, what we put into ourselves, and how we work ourselves. Okay. But we have to start that at a young age. My biggest thing, people say, hey, you have an overweight person. I've been overweight my entire life, but you haven't been 60 in this overweight.
Right.
You see what I mean? So as you age, as you get older, yes, you're holding that weight at 20 and 30, and you may be doing okay, but at 60 and 70, you got that same body. You have that same heart. You got those same kidneys that have been working hard all these years to tote that weight. And then the food that you're putting in.
I can believe it.
And the sedentary lifestyle and not getting up and moving. You would be surprised by what just getting up and walking around the block. Walking down to the end of your driveway and back. Taking the stairs in your job. Just little things like that can do.
Okay. All right. So I was gonna ask you this other question. You kind of went past it. I was gonna say,
ask it, because I'm sure something else
you
I
already
can
answered it. I was gonna say, like, all right, how much heart disease is preventable? But you just pretty much already answered it.
It is. I would not say 100% preventable at all. It's by far not 100% preventable. However, you can do some things to, again, like I said, It's not 100% preventable, and you may find yourself in the situation that you've seen your family members go through.
Right.
But the difference is going to be when it happens to you and how it affects you when it does happen.
Right.
So let's say, for example, coronary artery disease. So coronary artery disease is a blockage of blood flow through your coronary arteries, right?
Mm-hmm.
So I tell people your heart's like a house. You have plumbing and you have electricity.
Mm-hmm.
Electricity is what gives your heart that beat, that rhythm. When you hear people say, oh, I'm in sinus rhythm, or I have atrial fibrillation, or I have atrial flutter, VTAC, SVT, those different things, those are electrical issues typically. Right. Plumbing issues, your heart works as a pump, and it pumps blood through the rest of your body, right? So on your heart, you have coronary arteries. Those coronary arteries go to different parts of your heart, and it provides different parts of your heart muscle with blood and oxygen.
To not cut you off.
Okay.
Coronary arteries are the arteries that are surrounding your heart.
Your heart.
That's the ones that's on the actual walls of your heart. Yes,
they're the outside of your heart. And they provide each part of your heart, because your heart's a muscle at the end of the day.
Right.
And it provides each part of the heart with blood and oxygen. What happens with coronary artery disease is those arteries get blocked. So the blood flow and the oxygen, the food that your heart needs, is not reaching certain parts of the heart. Mm-hmm. So when that blockage gets to be too significant, that's when people have heart attacks.
Right.
So with coronary artery disease, typically what's blocking the arteries is plaque buildup. Where does plaque build up? Cholesterol. Where does cholesterol come from? Diet. Right. Now, some people have circulating amounts of cholesterol in their blood because of hereditary factors, but those greasy, fatty, fried foods that we eat also increase the circulating cholesterol. That cholesterol sticks to the inside of the vessels clog like a pipe. Think about a pipe in your house. That's why I say your heart's like a house. That pipe blocks up. Guess what that water's doing? Now it's sitting in your sink. It's backing up. The same thing happens in your heart. You got to keep those pipes clear. Okay. Right. With that comes your diet, comes your exercise. Okay. And that's how you, hopefully, all the things together is what helps reduce your risk. It's not one thing. It's all the things together, multiple things. Keeping your weight down, exercising, making sure you have a good diet. Those things work together to help protect your heart.
Okay. So let's kind of go into the thing that, all right, signs that people tend to ignore. Like, what are some of the warning signs that often people dismiss?
Ooh, fatigue. Fatigue is a big one.
Okay.
And just overall not feeling well. If I have somebody come in and they have coronary artery disease and they have a heart attack, and they come in and they say, oh, I'm having chest pain, I'm having chest pressure. 9 times out of 10, and if I ask them, how have you been feeling the last few weeks or few months? Oh, I've been more tired than normal. Mm-hmm. I've been sleeping more. Prime example, I walk around my job. I work in a warehouse. I walk around my job all day, every day. I probably walk a mile, and I do it with no issues. Mm-hmm. But over the past few months, I've been finding myself stopping and taking a break because I get tired or I get short of breath. That usually precedes any pain. Mm-hmm. Usually that precedes any pain. Or I have somebody who is active. Just last week, I had a gentleman say, hey, I run 2 miles a day. 2 miles a day. I got to 1.5 miles, and I said, whew.
I'm tired.
Yeah, I'm tired. This is odd. And then a week or two later, 1 mile, and I'm tired. And then I noticed some chest pressure, and here I am. Mm-hmm. You see what I mean? So it's just little things like that. Uh-huh. And then with that fatigue, and the chest pain, you have to tell got to say this, women are different. Mm-hmm. So you may have a woman that never gets an ounce of chest pain. Mm-hmm. She may get upper back pain. She may get jaw pain. She may get neck pain. Mm-hmm. One of my favorite stories to tell, I'm in the ER and I have a lady that come in and she says, I got a bad tooth. My tooth has been hurting me all week. She said, and I just need something. I'm going to the dentist on Monday. It's over the weekend. I'm going to the dentist on Monday. And I said, okay, tell me about that toothache. She said, yeah, it's been hurting. And now it's going into my ear and down into my neck. And I said, well, wait a minute. I hear you about your tooth, but let me just get a quick EKG. That lady was having a heart attack. Having a heart attack. She's like, I'm not, and she kept saying, I'm not having chest pain. I'm not having chest pain. Now, I'm a practitioner in the ER at this point. I'm not having chest pain. I know, ma'am. But, ma'am, I'm not having that elephant on my chest. I understand.
But
you are still having a heart attack. You see what?
So this is another part, swelling. Because I have a lot of patients that I see, and then they'll sit there and be asking me like, well, I got this random swelling that's just down here in my legs. And but it wasn't there before, and I'll sit there and say, okay, is it in both of them or is it in one?
One.
And they'll say, it's only over here on my left side. I was like, I need you to make an appointment.
Yes.
To your MD. So they can go. And then they looking at me like, why you talking to me like that? I said, because this is important.
Yeah, you could have a blockage.
You could be having a blockage. And I said, I can't say that specifically, but what you're hearing me sit here and say not in a court of law. You might be having something going on. So I need you to go ahead and make an appointment today.
Yeah. So with swelling, swelling is a big symptom. It really is. And for me, and I can't speak to every other practitioner out there. I can't speak to every other health professional. But if somebody says I'm having swelling in both of my legs, it is their heart to prove otherwise. And the reason I say that is because, swelling in one extremity, let's say, like you said, you have swelling in one leg, right? My next question is going to be, how long has that swelling been there? Have you had any pain in that leg? Because I'm immediately thinking a blood clot. I'm thinking deep vein thrombosis, DVT, as you may hear people talk about. That's what I'm thinking about. But swelling in both of your legs. Now, you do have some people that have swelling that is unrelated to their heart. Right. They have vascular issues and they have swelling. But it would behoove you to check your heart. Because a lot of my patients who have specifically congestive heart failure, a lot of their initial symptoms is swelling in their legs.
That's how my dad was.
And shortness of breath.
Yep.
You know what I mean?
Yep.
They come in and say, I've been swelling in both of my legs and now I'm a little short of breath. And the biggest thing that normally brings them in is, I can't lay flat when I go to sleep.
True.
You see what I mean? They'll say, "Oh, I have swell. I feel like I'm drowning.
I feel like
I'm
Drowning.
suffocating.
I feel like I'm like having a hard time breathing.
Yes.
On my
I've
bed.
been swelling for a while, but now when I lay flat, I either cough or I can't breathe. That's something. That's what normally brings them in.
So what? All right. So what are the difference? I mean, when it comes between men and women when it comes to heart attack.
So. Anybody that comes in with shortness of breath and fatigue, that kind of goes across gender lines. Okay. It does. But with women, we don't typically, and now they do. There are some exceptions to the rule. Don't get me wrong. This is not 100%. Okay. We do have women that come in that have chest pain.
Right.
That say, I feel like there's a squeezing in my chest. I feel like there's a pressure in my chest. But more often it's men who say, I have that elephant. Right. I have this chest pain. I have this shoulder pain. It's going down my left arm. That's more often men. Women, it would be important to listen to their symptoms because a lot of them will say, I'm having jaw pain. I'm having neck pain. It may go down both of their arms. They may, like I said, they may not have an ounce of chest pain, but they got pain between their shoulder blades. Right. You see what I mean? That's where I listen to my women a little bit differently. And I have men that have those same symptoms. Don't get me wrong. But if I had to line up men and women and they said, name these symptoms, back pain, jaw pain, arm pain, I just don't feel right, I'm going to give that to a woman. Okay. Chest pain, you know what I mean? Shoulder pain, I'm going to give that more to a man. Okay.
So why do you feel like people wait?
Because they try to chalk it up. Because really and truly, remember I said, we're going to go back to what I said before. Most of my people come in and when they say I'm having chest pain, that wasn't their first symptom. No. So they wait because they chalk it up to other things. But my population's typically older, old people in my tribe. But a lot of times they chalk it up to them getting older.
I do hear that.
You see what I mean? I thought I was just getting older. I thought I did too much that day. They try to find a reason to explain their symptoms. Yeah, they don't want to go. They don't want to go. They try to find a reason to explain why they feel the way they do. So they say, oh, even when and this is outside of heart, my stroke people, they come in and they say, oh yeah, I had this weakness in my left arm. I thought I was tired, so I took a nap. No. You know what I mean? I had blurred vision, and I thought my eyes were just tired. I thought I had done too much, or, my speech was slurred, so I said, oh, you must be tired. And that's typically what happens. That's even with your heart. They say, I've been short of breath. Well, I did more today than I normally do. I decided to go to the gym and I was on the treadmill and I got short of breath and I got tired. So I was like, I hadn't worked out in a while. No, that was your poor man's stress test. Yeah. That told you shouldn't have been.
That's exactly what that was.
That was your poor man's stress test.
So let's go with, all right, so we're going to talk about stress a little bit more. All right, so we carry a unique kind of stress. We do, Financial pressures, racial
Family.
pressures, family responsibilities, like just in general. How does a chronic stress physically affect the
Okay,
body?
so y'all,
For the most
there is
part?
this thing in cardiovascular care called Takotsubo cardiomyopathy, and
Hold
it
on, say that again.
Takotsubo cardiomyopathy. Other words, it's called broken heart syndrome
Okay, I
or
know that one.
stress-induced cardiomyopathy.
Yeah, I didn't heard that
The
one.
actual name of it though is
Takotsubo.
Takotsubo. Yes, Takotsubo. And there's a reason there's a name, an octopus shape, the way that your heart looks.
Yeah.
It's a thing.
Okay.
But simply, it's stress-induced cardiomyopathy.
Mm.
And these people come in and they have chest pain, they have shortness of breath, they think they're having a heart attack.
Mm-hmm.
But when we do the heart cath and we do the stress test and we do all these things, their vessels are clean, but their heart's weak. And a lot of times you ask them, what's going on? And they say, oh, I'm having stress. No. In your world, what's going on? Oh, well, I've been dealing with the loss of my mother. I've been dealing with the stress of these kids. I lost my job. I got all these things. Usually, it's rooted in stress.
So environmental stress.
Yes, long-term stressors is what'll happen. And they'll come in and they'll have acute, and that means quickly weakening heart muscle. So I'll do an echocardiogram, and this 35, 45-year-old person has a weak heart. So normal pump function on a heart is 55% or higher, just to put it into perspective. And theirs is functioning at 20 to 30%. And the way their heart looks, you know that it's acute, meaning it happened quickly, and there's no other cause. Their coronary arteries are okay. Their heart muscle looks normal. Aside from it being weak, this doesn't look like it's been happening over a long period of time. This is an acute event that's stress-induced.
Okay, that makes sense.
Stress-induced.
So cortisol levels. Mm-hmm. Kind of talk about that a little bit.
So with your cortisol levels affect a lot of you, as do a lot of your hormone and your regulatory things that happen in your body that people aren't aware of. With fluctuations in cortisol levels, that's where you have people hanging on to weight. That's where you have people that it actually can affect your blood pressure.
Yeah.
It can affect your metabolic things. It can affect your renal issue. It can affect renal issues. Cortisol is one of those things that circulate that have to have a homeostatic level. Right. Has to be at homeostasis. Any fluctuation in that can cause your blood pressure to go up. It can cause your heart rate to go up. It can cause your kidneys to act up. It can actually cause GI issues because you're not at a level where you should be. And all those things I just named are affected by stress. And stress causes what to your cortisol levels?
So to help everybody about what cortisol is, it is a hormone that your body produces when you're stressed.
Yes.
Now, usually it's on that nice little adrenal gland that's on top of your kidneys.
Yep.
A lot of times y'all don't be thinking it do anything, but it do a lot.
It does. It does. And it will shoot, and that cortisol level shoots up and everything responds.
Yep.
Everything responds. And how long that stress lasts determines how it affects your health.
Doesn't that also affect thyroid levels too?
It does. And your thyroid is another thing that holds you together. People don't realize how much your thyroid affects your overall system. I had a friend of mine that was diagnosed with hypothyroidism. That's underactive thyroid. And started taking the medicine and was like, I feel good. And stopped taking the medicine because that's what some of us do. You know, they stop taking their medicine because they feel good, not realizing the medicine is why you feel good.
Right.
We'll get back to that in a second.
Okay.
However, with this thyroid, she stopped taking her medicine and she said, girl, I felt like I was about to have a nervous breakdown. She said, because her levels were all over the place. And you don't realize how much a gland that might be this big affects all of you.
Yeah.
It sits right here and it affects every aspect of your being.
Okay. So
now back to this medicine, because I said I was going to go back to it.
I was going to say, bring that back. Bring that
back. So people, when I tell y'all, I do not want to, I tell my patients, I do not want to put you on medicine. I don't. And a lot of especially the Black community say, you're getting kickback for these medicines. You put me on all these medicines because it's making you money. Actually, I look better the least amount of medicines I have you on. That looks better for me. Because that means I'm taking care of you. Yes, I'm taking care of you. If you don't need all this medicine, that means you're healthy, your blood pressure's good, your kidneys are where they're supposed to be, your heart's functioning like it should. You see what I mean? So the more medicines you are on, the iller you are. But with medicine, the reason I will put you on a medicine, let's have a scenario. All right, we'll do something simple like cholesterol, right? Cholesterol is a big deal in heart health. You come in and I check your cholesterol and I say, Peete, you have a family history of heart problems, right? You have a family history of blood pressure issues. You have a family history of high cholesterol. Let's check your labs today and see where you are. Your cholesterol, your bad cholesterol, LDL, which is what we look at a lot of times, is 130. Optimally, I would like for you to be less than 100, right? I'm seeing you don't have any of this stuff going on yet, but I'm trying to prevent it from getting there. Right. So I say, okay, your cholesterol level is 130. Fred, I want you to change your diet, okay? We're not going to start any medicines. I want you to change your diet. Reduce your intake of greasy, fatty, fried foods. Start eating more fish. Start eating more chicken and turkey. Reduce your salt. Increase your exercise. I'm going to bring you back in 3 months. Let's see how you do, right? You come back in 3 months, your cholesterol is 150. You can't be trusted. Now I got to put you on.
You said I can't be trusted. Hold up.
Now I have to put you on medicine. And the reason being is because I'm keeping you safe until you make those lifestyle changes. Okay. It is not forever. People end up being on medicine
because
forever
they don't want to change.
Because they don't change the lifestyle.
Okay, so
but I put you on it to keep you safe in the meantime.
Okay, that makes sense.
You see what I mean?
I
so
see
when I
put
you on that cholesterol medicine and we come back in 6 months and your number's going down, good.
Okay.
I see you again in 3 months. Okay. They steady going down. Okay, let's go down on a dose of medicine. Let's see how you do.
And a lot of people, I don't feel like a lot of people even realize that. They be thinking like it's the end all of everything.
No, it is to keep you safe, even with your blood pressure. So high blood pressure is the number one reason that people are on dialysis, uncontrolled high blood pressure. So when you come in and your blood pressure is high, your heart is a muscle. Remember I told you that. So let's say your blood pressure is high and you come in. The reason I put you on medicine is because I'm trying to keep you safe until you do the things to lower your blood pressure. Right. When your blood pressure is high, think about resistance. Your heart is meeting resistance. It's having to work harder to pump that blood out because your blood pressure is high. So your heart's going to grow as a muscle. Your heart is one muscle you don't want to grow.
But a lot of people be thinking that.
You don't.
I got a big heart.
No, enlarged heart is not good.
That's that means it's holding on to it.
It is, that is bad. Your heart is working too hard. So when your blood pressure is high, I say, okay, I'm going to put you on some medicine to help lower your blood pressure. When I lower your blood pressure, good. Okay, now go exercise. Go lose some weight. Change your diet. So when you come back and your blood pressure is good and steady and dropping, I'm lowering the dosage of the medicine because I can't stop it suddenly. I have to slowly lower it. So when I do take it off, we ain't got to go back. Right. And guess what you've done? You've changed your habits. You've changed your lifestyle that is conducive to not being on that medicine.
Okay. So we're going to go ahead. All right. So you in there ask that question too? Because I was sure about to ask you. Well, I'm just saying the nutrition and movement, realistic play, and especially in neighborhoods where healthy options are easily accessible. Well, shoot.
So let me tell you this. Okay, we can touch on that.
You kind of already did though.
We can touch on that. So I hate when people say you should just eat healthy. It is expensive. I'm not gonna sit here and talk to my people like it's not. It is more expensive. However, it's more beneficial. But there are ways that you can do some less expensive options to make it better. So I like vegetables, right? Frozen vegetables, you can go to the frozen section and get a bag of vegetables. That's the best way to do it.
That's what we was talking about.
That's the best way to do
Ryan
it.
Said the same
yes, but let's say you can't and you have can, right? Let me tell you what to do with that can. That can, find you a can that has lower sodium, right? That low sodium can, that juice that's in that can, pour that off and put fresh water. That helps reduce the sodium content.
It's gonna mess up them glory greens, though.
It will, but you're doing something. You see what I mean?
I see what you're
now,
saying.
fresh is always gonna be the best. Then you got your frozen. I will put frozen really up there with fresh because they don't have any preservatives or anything in them.
Right.
But there are people who have cans, and that is okay. Pour that juice off those green beans. Don't put that bacon in them green beans. Put you some fresh water on those canned green beans. And while it's not the best, it's sure better. Okay. It's sure better. You see what I mean? With your meats, any meat that comes in a package, like your cold cuts, we love souse and lunch meat and that ham in that package and that turkey in that package, that's loaded with sodium because it has to be preserved.
Okay.
Go get you some meat on a bone. Get you some chicken, some fish, some ground turkey. It doesn't taste the best because it doesn't have that fat in it.
It ain't got that fat.
But it's better for you.
It ain't that season.
It's better for you.
Okay.
And instead of doing salty, a lot of times, if you can counter salt with a little bit of spice, it's a little bit better.
Spice is actually better than salt.
Than the salt. A lot of your spices, so you can do, cumin and curry and all those things. They are lower on the sodium content, and then they will add flavor that you think you're missing. Okay. That's where you have to play around with those spices.
I can see it.
McCormick makes a no salt all-purpose seasoning. Do that.
Okay.
Is it the best? No, but it's better than adding the salt. Take the salt bottles off the table. You know what I mean? Just little stuff like that.
Okay.
Very small things.
So let's get into our next segment over here real quick. All right, so we're going to talk a little bit more about prevention and practical stuff and everything like that. If someone that was watching has never prioritized health, like heart health, what is the very first step they should take?
The very first step you should take is finding you a primary care provider. Okay. And the reason I say that is because you can eat healthy, you can exercise, you can do all those things. That's your foundation. However, you need to know where you are systemically. Okay. So if you check, and the reason I say that is a primary care provider holds all of you together, right? They can send you out to different specialists, but ultimately they keep everything together. So your primary care provider, as a young person, going to a primary care provider and getting simple labs done, that can do wonders. That can do wonders because that can tell you if the diet you're eating is effective.
Right.
That can tell you if you're borderline for certain things so that you can go ahead and change what you're doing. So if you go to your primary care provider and they draw labs and they say, all right, your electrolytes, your potassium, your magnesium, your calcium's good.
And what's the name of the test, by the way?
You can do like a simple comprehensive metabolic panel. A complete blood count. Just little simple tests like that. Or what we say a CMP or a BMP, basic metabolic panel.
I know what they were. I just wanted you to say it out loud for everybody to understand.
Those basic labs will give you a lot of information because you're going to check your blood counts. You're going to check your kidneys. They're going to check and make your liver is in that.
Right.
Also, as well as your potassium level, your magnesium, your calcium, your sodium levels. It's going to check all of those things. And that'll let you know if the diet you're eating is doing well. And they may say, hey, everything looks good right now, Dr. Peete. Everything looks good. You may need a little vitamin D, but everything looks good. Keep doing what you're doing. They check your blood pressure. Oh, your blood pressure's a little elevated. Cut back on your salt. Nothing to do right now. And that's a lot of times what happens. Nothing to do right now, but start cutting back on your salt. What they do, don't cut back on their salt. And then the next time they come and their blood pressure up, they want more time. But I gave you more time on the front end. Absolutely. And then the next thing, too, with the primary care provider is they will ask you what things ail your parents. Does your mom or your dad have high blood pressure? Do they have diabetes? Do they have kidney problems? Any heart disease in your family? And the reason they ask those questions is because they need to know how to screen you.
Right.
So for me, if I have somebody that's diagnosed with new coronary artery disease and we've put 2 stents in them, or, they have heart disease, they're 60 years old. Their children should start being checked 40. Because that's when you're trying to prevent what has happened to your parents.
No, that's fair.
You know better, you do better. You see what I mean?
Right.
So as a primary care provider, they can do a simple test like a CT calcium score. A CT calcium score gives you the amount of circulating calcium in your bloodstream. Well, not even I would say dietary calcium, but it lets you know about your buildup in your vessels is what it really is talking about. So you see a CT calcium score and people say, oh, calcium, we get that from foods. That's not what we're talking about.
But your calcium is supposed to stay at the same level throughout your life.
Exactly. And so with that test, it'll say, okay, you get this score. And this score, CT calcium score, lets you know what your what your burden is in your bloodstream,
Okay.
in your vessels, specifically your coronary arteries. And based on that number, it tells you what to do from there. But that is a screening tool. So what you can do is stay above or stay on top of your screenings.
So what would you say annually a person needs to get checked?
Annually, labs. That's it.
So you would say like what?
CBC
once a year?
It depends.
Every 6 months.
It depends. So with a young person, let's say I have somebody who's young, otherwise healthy, I can screen them annually. As you get older, it may go to every 6 months. Or if your doctor sees, remember I said, hey, you're a little borderline on this blood pressure. You're a little borderline on your liver, and something is right there on the cusp. I may bring you back every 6 months.
Okay.
It depends on what we find.
Okay.
But the best place to start with you. Eat healthy, exercise, keep moving, but get you a primary care provider, because certain things inside your body you just can't tell.
Okay.
A lot of things don't show symptoms until they've been going on for a while. You don't want to wait till then.
Let me see. I think you jumped the gun again.
Okay, my bad.
You good. All right. So pretty much, I can ask this question right here. You ain't jumped the gun on this one. If we started educating our children earlier about heart health, what could change in the generation?
I think we already have people living longer, but I wouldn't necessarily say that they're living
It's
well.
not a good quality of life.
Yeah, their quality of life isn't the thing. You're surviving. You're not living. You're not thriving. With our children, teaching them how to make healthy choices early is a big deal. That shapes who they are later in life. That shapes the choices they make as far as their food. It's difficult for a child to grasp something that's going to possibly ail them 30 years from now, 40 years from now. But if you put healthy foods in front of them and give them healthy options, then they're going to continue to make those healthy choices. Right. So instead of sitting them down with the chicken nuggets and the French fries and the sugary beverages, putting vegetables on their plate, putting fruits on their plate, giving them water. Having a child fall in love with water is one of the best things you can ever do, because that is going to follow them.
I'm fighting.
It's hard. It's so hard. It's so hard. So this is why I tell parents, go ahead and get the baby the juice. But make one part juice and 2 parts water. It's simple.
That sugar high is real.
It is hot. It is real.
That sugar high is real.
It's hard to stop something that's already there. You see what I mean? Mm-hmm. So the way that you do it is you start to cut it back. Yeah, they think they're getting that juice, but they don't realize mom and daddy done cut it. You know what I mean?
Well, we've been having half lemonade, half water.
Yes, that's what I'm saying.
We've been diluting that thing.
You cutting it, and that's how if you can start from scratch, and you got this baby coming up, and they only know water, and they only know these healthy choices. That's good, but a lot of times they find out about these things not in your house.
It ain't that.
What?
I'm gonna look at this camera. It's y'all grandparents.
You hear me say
that's
not in your house.
It's y'all grandparents. That's what it is.
Listen, so I wasn't gonna go for them. But we know.
I understand.
And
they raised us.
But they raised them. Them
but
grandbabies
they be spoiling
different.
them. Man, they treat us
different.
They treat them different.
So that's why I said not in your house.
Okay.
Because they'll get exposed to these things, and they come home and they're like, "Mama, Daddy, I want to squeeze it. I want to." We had squeezes back then. I want a Capri Sun.
I want a Capri Sun.
I want
a Capri Sun.
Because I want juice.
I want a yogurt. I want
this because they've gotten it, and that's okay. But just start. Okay, you can have this baby, but you need to have some water. Yeah. You're going to eat these fruits. You're going to eat these vegetables. That's really the big thing of it.
Okay. All right. But I'm sorry, Mama. If you watching this, I'm going to apologize.
Look, don't come for me.
Okay.
It wasn't me. It was
all right. So this is going to be our last question right here.
Okay.
All right. So legacy-wise. So you see the impact every day. You see lives that you've saved. You see lives that you've lost. What does protecting your heart mean to you personally?
It means being here to see generations to come. It does. It means being able to, I have a daughter that is 19, being able to see her children and potentially her children's children. That's the big deal. And not only being able to see them, but being able to participate in their lives. No, it's different. You in a wheelchair and you can't even get on the floor with your grandbabies. or you can't go and throw the ball in the yard with your grandchildren because you out of breath, because you haven't taken care of yourself. And to be able to see those generations, like my father in love, he is able to see his grandchildren have children. He is 70 years old and runs a lawn business.
Right.
You know what I mean? It's a big deal for him to be able to be present.
That's a
big deal. He's running and getting around with the best of them. You know, and that's what I want. That's what's so important. Is to not only be able to live, but to live well.
Okay. Man, shoot. That was my last question right there. Shoot.
This is awesome.
You know what? I gotta ask them. Tell them how they can.
Well, actually, for me, so I am a practitioner inpatient. I just swapped. I used to do a 50-50 split where I would do 1 week in the hospital and 1 week in the clinic. Now I'm in the hospital full time. So I have the blessing and the curse of seeing people at their best and at their worst. But I work out of Sutherland Cardiology Clinic. Okay. It's on Wolf River Boulevard. We have a lot of outpatient providers that are phenomenal providers. I tell people, and hey, I may be a little biased. I work with some of the best doctors in the city. Okay. When I say they are amazing and they love what they do, my group is like a family. We teach each other. I have learned more from people that I work with than I'll probably say I learned in school. I work for a doctor who's been doing this longer than I've been in the world. Literally. The man has been practicing longer than I've been in the world. Okay. And he can teach you some things that they aren't teaching in school. You know, we run into an issue where a system or a machine breaks down, and he's like, go get me some tape, a Foley catheter, and a suction cup. Dang. And we're like, what? But we don't know. You know what I mean? And it's that wisdom and that knowledge that's in my group. Okay. It's unbelievable. So Sutherland Cardiology Clinic, you won't go wrong. Okay.
The heart does not take a day off. It beats through stress, it beats through silence, it beats through survival. But it cannot be forever without care. In our community, heart health is not optional. It's essential. When we check our numbers, when we move our bodies, when we manage our stress, when we show up for our appointments, we choose life. Dr. Rice, thank you for sharing your expertise and your heart with us today.
Absolutely. You're welcome. Happy to be here.
Thank you.
Happy to be here.